We will just give it another couple of minutes and see if we've got anybody else joining us today. Okay, perfect. We will get started. So thanks so much for coming along, everyone, today. I just want to introduce myself. I'm Lucy, and I lead the Compassionate Employers programme here at Hospice UK. So my job is to work with organisations across the UK to review their policies, their guidance, and support, and ensure that they are prepared to support employees through those really vulnerable moments in life, including terminal illness, caring responsibilities, and bereavement. We also work with health and social care professionals across the UK to deliver coping with professional grief workshops, which brings greater visibility and education to the healthcare workforce on the impact of professional grief. And we'll touch a little bit on professional grief later on in this session, but these sessions, these workshops really help to equip frontline staff with the skills and knowledge to support themselves better through long-term exposure to death and dying, to try and help prevent burnout and compassion fatigue, something we are seeing increasingly in the healthcare workforce. So throughout 2025, compassionate employers are going to be running a series of awareness days to help raise greater visibility around key topics that people may be facing. Today is the first in a series of events, so we will be testing this kind of new way of delivering these sessions with hope that having recorded sessions that people can watch back will be hopefully a really helpful time, a helpful way to engage more of our members throughout the year. So some of the sessions that we've got coming up later this year, and we will send some information about after today's session, is in June, we will be doing a session around supporting carers in the workplace, all around Carers Week. So looking at the impact of being a carer outside of work, as well as then having to deliver care inside work. In September, we're going to be looking at understanding grief after suicide. It's becoming an increasing challenge in the healthcare sector that we are seeing more and more people struggling with their mental health on long-term sick, and unfortunately a rise in suicide cases among healthcare workers. So really important just to have a little spotlight on that in September. And then in December, it is National Grief Awareness Week, the first week in December. So we'll be doing a bit of a session just highlighting the importance of supporting each other through grief and bereavement at work, especially when we have these caring roles. So just before we get started, just, due to the nature of this topic, just a gentle reminder that, it's really important to look after yourselves. So if you feel triggered or upset by any of the content, please feel free to take time out. As mentioned, this session is being recorded. So if you woke up this morning and thinking, okay, I definitely want to go along, but actually you're feeling that you could do with this time back right now, and actually this topic might be something that's too triggering for you right now, then feel free to watch the recording back at any time after this. I'd also recommend, if you can, I know this is really hard sometimes in healthcare, but take a step away from your screens after this session. Try and get a little bit of a break. Try and go outside. Hopefully it's relatively nice weather wherever you are, and get some fresh air, just to kind of let yourself have some perspective on the session and deal with any emotions that may arise for you. So without further ado, some of the things that we'd like you to leave today with, is to leave this session having had some space to reflect on the COVID-19 pandemic, to leave this session with an understanding of different types of grief, including professional grief, and just having a bit more of an understanding about how that might present for you or those around you, and to leave this session with some tips on how you can better support yourselves and how you can better support the people around you too. So, believe it or not, it's 5 years since the first lockdown happened in the UK, which is a kind of startling fact in itself. And the pandemic had a huge impact on the health of healthcare workers across the UK. So 68.7% of healthcare workers reported the pandemic negatively impacted their mental health. 43.9% of healthcare workers reported that it negatively impacted their physical health as well. 73% of staff report that they have experienced burnout or exhaustion at least some of the time in the last few years since the pandemic, with 27% reporting that they always or most of the time feel that way. And really kind of startling, and looking more so at our nurses, the post-pandemic reports released by the NMC in autumn last year showed that there are thousands of nurses who are walking away within the first 10 years of their getting their registration due to burnout and exhaustion brought on by low staffing levels and increasing patient need. So we're seeing this conversation around workforce wellbeing becoming more and more prominent, and the pandemic was a catalyst for that. And we'll talk throughout this session just about, the fact that a lot of healthcare workers really were going complete full commitment with the light at the end of the tunnel, knowing that the pandemic was going to come to a close, and hopefully that we were going to get to a point where we would be able to function as normal again. Unfortunately, that normal hasn't ever really quite appeared for a lot of healthcare settings, and we are seeing that increased burnout and that increased challenge for mental health of healthcare workers as they are chasing that light at the end of the tunnel, looking for when they're going to catch that break and have that support in place, and the pressure is going to be less. So really, really important for us to be reflecting on this 5 years on, and just be really aware, I suppose, that actually, although the pandemic maybe looks like it's over, looks like it's happened 5 years ago, the lasting impact is something that we are feeling very, very really every day within a healthcare workforce. So just to bring that to light a little bit, I suppose some of these quotes came out of the COVID-19 impact report. It became difficult to remain positive, seeing so much suffering as so many patients died. It felt isolating. I felt I couldn't do anything outside of work because everything was so mentally challenging and exhausting. It was difficult keeping so far from friends and loved ones, and missing family members who were shielding or unwell. Living with fear was worrying and exhausting. You didn't have time for having mental health issues. You just needed to get on with it because you were doing your job, and sorry, because it was a job that you were doing, and you felt like you were fighting for your own life every day. I don't think I've come back 100% of how I was before. It takes its toll. It's almost like having a piece of paper that's nice and flat and straight, and then you've crumbled it, and you try to straighten it out, but it's still creased. No matter how much you try, it doesn't go back to the way it was. Now, I think that last quote there is something that really stuck with me when I was looking at each of the reports into the impact on employee well-being after the pandemic. So many of us felt really crumpled through the pandemic. We were pushed to our limits, and actually many of us have not had the recovery time or the reflection time. So I'm really hoping that this session today can help be a little bit of that reflection time. And if you're watching after today's event, then I'm hoping that it will give you some of those tools to hold some of that reflection space for yourself. So we saw a rise of professional grief, of burnout and compassion fatigue throughout the pandemic. And today, 5 years on, it doesn't really show the signs of slowing down yet. So I just thought it'd be good to start with highlighting what some of those key definitions mean. So, professional grief is a type of grief that is experienced by employees as part of the work that they do. Some workers will experience this often, for example, those who maybe work in acute hospital settings, in intensive care units, or in palliative care. And others may then experience this more in ad hoc settings, for example, in community care services. Burnout is a state of physical and emotional exhaustion. It can occur when you experience long-term stress in your job or when you have worked in a physically or emotionally draining role for a long time. Compassion fatigue is a specific form of burnout, and it's characterized by emotional and physical exhaustion, which diminishes our ability to emphasize or feel compassion to others. Now you can understand why each of these areas would be crucial for us to address, as they are impacting patient care. They're impacting our ability to do the job that we care so much about to the best of our ability. So it's really important that we highlight that throughout today's session so that we can really reflect on actually how are these things impacting the way that we perform. So just to touch on professional grief, what does this look like? Not everybody's heard about the term professional grief. It's something where we hold these workshops each month, and each month we have people who come along who work in all different sectors, and they maybe has never addressed it as professional grief, never addressed them as feelings that they were allowed to hold as their own experience of professional grief. So what might it look like? Reduced sense of empathy and sensitivity, feeling overwhelmed and exhausted by work demands, feeling detached and numb and emotionally disconnected, increased anxiety, sadness, anger and irritability, difficulty concentrating and making decisions, difficulty sleeping and sleep disturbances like nightmares, and neglecting our own self-care. Some of the very particular or specific examples that we've seen, unfortunately, month on month when we run these sessions, is an increased risk of health anxiety among healthcare workers, as we're looking at lots of very complex cases coming in to our healthcare services. We are worried about the services that are overstretched already. We're worried about people who are getting late diagnosis, and we are worried about ourselves and our families being in that position and having to rely on care services. So we're seeing a lot of health anxiety from healthcare workers. We're also seeing a massive impact on empathy and sensitivity, not just in a professional sense, but their lack of ability to empathize with themselves around their own emotions, but also those around them in their personal lives, which is having an impact on their relationships with their partners, with their children, with other family members and friends too. So it really, really, really is important for us to be looking at and addressing what professional grief might look like for our workforce, so that we can try and put those prevention tools in place to protect people, because it's not just about how they present at work, and it's not just about the care they're able to deliver, but it's also about looking holistically at all of the different parts of their life that it might be impacting, because that will overall have a bigger effect again on how they can show up at work. So how can we support each other through this? Acknowledging death and acknowledging its impact, listening without judgment or offering solutions, providing time and support for group debriefs, checking in regularly and not just when a death happens, signposting onto additional support. And we'll come on to this a little bit later, but as compassionate employers members, you will have access to huge amounts of signposting, providing regular clinical supervision, and really importantly, leading with compassion and vulnerability. One of the biggest challenges we see in healthcare is this the idea that we have to stay resilient at all times. And actually, it's very, very important to be able to create space for vulnerability, because people cannot be resilient without having some capacity to let all of those emotions out and to honor those emotions that might be coming up for them. And it might not be that every death impacts somebody, but it might be that a certain death impacts people more than others because it feels more familiar to them. It might feel like they can feel themselves in that person's shoes. It may be something that triggers their own experience of loss or bereavement. So it's really important just to be really mindful, and creating that space for compassion and vulnerability at all times, to accept these kind of emotions as they come up and processing them as they come up, so that people don't end up bubbling over. I thought this quote is one that really helps to kind of encapsulate what it is to be a healthcare worker at times. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water and not get wet. The reality is healthcare workers are under a huge amount of pressure, and that pressure is not just within the four walls of the organisation that they are working for, but they are also in the headlines frequently as services are so under pressure. People in the community being really worried about getting appointments in time, being able to access the care that they need, their families highly relying on that person who has that healthcare expertise coming to them for their expertise. So the pressure is throughout somebody's life and not just within the workplace. So it's really important just to recognize that actually being exposed constantly, it's going to have a big impact on people and their ability to cope. So just because you work in a healthcare setting doesn't make you immune to the impact of grief. So this next section is all about kind of building a greater understanding about grief and how it may present for us. And I think it's really important to just reflect on actually how grief looked different during the pandemic, largely because we are still seeing a huge number of people who were bereaved during the pandemic who have longer term complicated grief that is presenting for them year on year. And with this year being a big anniversary for lots of people who will have experienced a bereavement in 2020, I just think it's important to highlight what that grief and loss looked like during the pandemic. So every year it's actually estimated that 7 million people will experience grief following the death of somebody that they care about. It's a huge, huge number of people. During the pandemic, it was estimated that 1 in 7 employees were bereaved. People bereaved during the pandemic have reported feeling greater complications of guilt, of anger, and isolation whilst processing their grief. And there's still emotions that we're seeing people come along to us and looking for support with now, years down the line. Latest data shows that bereavement is one of the most common factors affecting employee performance at work, with an estimated 1 in 10 employees being impacted by grief at any given time. So again, something that's really, really important to be thinking about, especially whilst we're looking at the people who are delivering the care, also being the people who are dealing with their own personal losses and challenges. So really important, again, just to bring this to life, I didn't get to say goodbye to the person. I couldn't see my friends, so I felt really alone in my grief, spending the final months of their life separated because of lockdown. I had to say goodbye to my mum on the phone. I don't know if she heard me when I told her that I loved her. We could only have 10 people at his funeral. Only my mum could be there, so no one else got to see him and no one got to support her. I wasn't allowed to carry my dad into the crematorium. We weren't allowed to touch his coffin. In my family, we'd normally wash and dress the person who had died before the ceremony, but we weren't allowed to touch my grandma. And this final one, I hadn't even remembered the fact that healthcare workers were isolating away from their families, and so many people were having to spend that time away right at the beginning of the pandemic. I had to isolate away from my family because of work. This meant I didn't get to spend any time with my mum in her final weeks of her life. Just a really, really, really core um, feeling for somebody who had that experience, and something that we need to be remembering and honouring. I think so much of life has now just reverted back to normal, and there are still so many people who are dealing and processing with the complications that came with grief during the pandemic. So we're going to talk a little bit about disenfranchised grief. And this is a term that many people haven't heard of before. So disenfranchised grief is when a person loses something in their life that's important to them, but that loss is not valued or recognised by other people, either in society, within their families, within their workplace. So the loss of a job is an example of this, the breakdown in a relationship, the loss of good health, leaving your hometown, the loss of friendships, the loss of the life that you had before, complications with infertility and starting a family, mourning the life that you thought you would have, and mourning the death of a patient or a colleague. Now, I think there's a couple of things that are really important to highlight on this page. And there's the obvious, sorry, there's the obvious mourning the death of a patient or a colleague, which is not necessarily recognised in the workplace, but something that we see very commonly for people who are experiencing delivering the end of life care to patients. We also have the mourning the life that you thought you would have. And actually, we've heard this a lot when we are looking at people's identities within the healthcare sector. Most people join healthcare because they care deeply and they want to provide life-changing care for people, whether that's in their final days or whether that's to get them to a better place within their health. And unfortunately, so many services are so stretched at the moment that people are not able to deliver the care that they would like to be able to deliver. So we are seeing that grieving for the job they thought they had, for the job that they wanted to do, because it's not the way they thought it would be. And we're seeing that a lot in our coping with professional grief sessions. Now, I don't like to lean too heavily into grief models, but I do think the dual process grief model is one that is really helpful as a visualization of how grief works for lots of people. And I really think this is helpful, especially in a work setting. So whether it's disenfranchised grief, whether it's professional grief, whether it's anticipatory grief, where people are anticipating the death of somebody, this model helps to highlight how we bounce back and forth between loss and coping. So during our loss days, we may lean really heavily into our grief, sitting in the sadness and focusing on the life that we had before our loss. And I often refer to these days as duvet days. They're the days where we might feel so weighted down by our grief that we can barely peel ourselves off the bed or out off the sofa. And then during our restoration days, we may lean more heavily into making new memories, forming new relationships, and figuring out new identities after our loss. I think this model is particularly helpful for managers and colleagues, just to help people who are living with loss. And I think, really important to highlight, especially now around anniversaries. It can really help to highlight how grief ebbs and flows, and that no two days are necessarily the same. In the loss coping stage, an employee might find it hard to concentrate on tasks. They may seem withdrawn during meetings, or they may struggle to socialise with their colleagues. But the same employee a few days later may come back into work and seem more focused on their tasks. They may feel like they're engaging more with social events, and they may well be leaning into project work. But what's really important to recognise is that grief is not linear, and it's important to be able to be prepared to support people as they potentially ebb and flow back and forth between loss and restoration, sometimes for months and sometimes for years. We often make the mistake in society at looking at people in that restoration stage and going, they seem fine, they're getting on with it, they're keeping busy, it looks like they're moving on. But actually, there is no finish line for grief. Providing compassionate, flexible, and understanding environments really helps people who are living with loss and grief strive towards more time in those restoration days. So I think it's just really important for us to highlight this as part of this session as we're thinking about colleagues who maybe have experienced a recent loss or perhaps have an anniversary coming up and might be spending more time in those loss days, in that loss moments. Sorry. So we're just going to touch a little bit on what grief might look like. And I think this is really, really important when we're looking at how grief presents, and it is different for everyone. But it's really important to be aware of the different signs. Now, traditionally, people think about grief and they think, sadness, people will be crying, but they maybe don't think very far past that. So when we look at breaking it down into these slightly separate categories, so emotionally, yes, sadness is part of it, but that person might also be feeling anger at the person who's died or just the world around them. They might be feeling fear and anxiety. They might be feeling shock, even when death isn't sudden. The finality of death can feel really shocking. Numbness, lots of people go into total overwhelm and it sends them into survival mode, and it just sends them a bit numb to the world. And it might seem like they don't really care about anything, but that's a very, very normal way for people to respond to shock and to trauma. Loneliness, helplessness, guilt. And additionally, I think it's really important to talk about something that makes us all feel quite guilty if we've ever experienced it. But some people will experience a sense of relief, especially if they have been caring for somebody, if they've been living with anticipatory grief, worrying about what the end might look like, worrying about seeing that person in pain and suffering. Actually, a huge sense of relief can come from knowing that they don't have to suffer for that person anymore, and knowing that they don't need to worry about their care. So really important just to recognize that as something. Cognitive is something that we talk about, and that's our decreased ability to concentrate and process information. This can be something that is most noticeable at work, really. Difficulty in decision making, forgetfulness. We talk about brain fog, and I've worked with people who for months will feel so frustrated by the ability that grief is having on their ability to function as normal, and how tasks that maybe previously seemed really normal and really easy now feel complicated and exhausting. When we talk about behaviours, we might see people who are withdrawn from social interaction, maybe have irritability or a short fuse within families and within teams. That can feel like everybody's walking on eggshells, which can really challenge the culture and the community that you've got, especially within the workplace. Somebody might seem like they're hypersensitive, reacting to topics that maybe previously wouldn't have fazed them. Physically, something that we quite often shy away from talking about is the physical side of grief. But nearly everyone that we've spoken to have had some form of physical impact, whether that's sleep disturbances, weight loss, weight gain, aches, pains, IBS, headaches, or just being so physically run down that they end up poorly, having a terrible cold, having tonsillitis, lots and lots of different things that can impact our physical ability to process that grief. And finally, spiritually, it's really important to be sensitive that grief can really challenge somebody's faith. It can make them question the meaning of life or their belief systems. But on the flip side, it can also inspire people to lean much more heavily into their faith, becoming much more active within their faith community, or changing their practices of worship. So you can see why it's important when we talk about why it's important for us to talk about this and recognize and understand what grief might look like for different people. Because imagine coming back into the workplace and having all of these different things impacting you. So just really important to be mindful. No two experiences of grief are the same, and some of these symptoms may come and go, but it's really important just to be mindful of each of them whilst you're supporting yourself, whilst you're supporting other people. We'll share all of these slides afterwards, as I said, with all of the information. So, ultimately, we all have a life that's happening outside of work. And one of the big challenges is, how do you support people effectively with the things that they may be going through outside of work? And the reality is, learning to sit with people in that sadness and in those really difficult situations is often one of the kindest and most compassionate things you can do. But this doesn't necessarily come naturally to all of us. We are a society of fixers, and we are always quite scared of sitting in sadness with people without having the answers. So there is an e-learning tool on the Resource Hub that I will signpost you to later on, where you can run through and practice each of these skills. But this is a tool that we designed about how to have compassionate conversations, how to sit in those conversations with people who are needing help. So listen attentively, paying undivided attention, being present in the conversation, not just listening to respond. If you're in a work setting, think about minimizing distractions so you can be fully present. Turn on Do Not Disturb, find a private room, avoid busy settings. Very difficult to do when you're on a ward or in a busy office, but always worth trying to find that private space to have that conversation, even if that means saying, there's no rooms available, I'd like to have some private time with you, let's go for a 5-minute walk around the block. Respond mindfully. So take a moment to process before you respond. Consider what you've heard so you can build on the conversation. Take their lead, mirror their language, and where possible, make the conversation personal by referring to things that they have shared earlier in the conversation. This is a really, really important active listening tool, and it's something that we don't necessarily do very well as a society. I think probably worse with the advancement of technology. Being observant, so noticing details, body language, mood, and attitude. Trying to remain in an open stance, being patient whilst they talk, trying not to seem restless. We can all be a little bit fidgety, and it's okay to be a bit fidgety, but trying to be present is very, very important. Fidgeting can make people, or being restless can make people seem like maybe you want to be somewhere else, and maybe you don't want to sit in this conversation, and it might be making you uncomfortable, which can put barriers in the way of them being completely open and transparent with the challenges that they're going through. Managing silence, learning to sit comfortably in silence. We're not very good at this as a society, and it's something that I'm personally trying to work on quite a bit. But silence is a really healthy thing, and sometimes it's really important, and sometimes it's all that people need, is just to have somebody sitting in that silence with them. Respect emotions, so acknowledge that all emotions are valid. Don't deny any of the ones that you don't relate to. Try to remain neutral. Remember that we all have different responses to challenges in our lives, and we all respond with different emotions, and they might all come up in different ways for us. So trying just to respect those and make space for all emotions that arise. It's okay if some of them make you uncomfortable. As I said, we're a society of fixers, and we really struggle to see the people that we care about being sad or angry. And so we often try to find the solution, but actually sitting in those emotions with that person and holding that space for them is really important. And it's a really great way to let them know that it's okay to be vulnerable with you and that any emotion that they're experiencing is valid. And lastly, considering other perspectives. So, welcome other experiences without holding judgments. Try not to project your own experiences back on that person. Be mindful of sharing your own personal experiences without permission. It can be really helpful for some people to share personal experiences, but make sure that you are always prioritizing that employee or the person who's come to you over your own emotions. Some examples of this might be that, we hear quite often when people are having difficult conversations about illness or grief, people will immediately respond, "Oh, yeah, my dad had that type of cancer and he died really quickly. It was awful. So I totally know how you feel." And, although it might be helpful for that person to know that actually you have lived experience, oversharing in the wrong moment can really diminish or belittle somebody else's experiences and their feelings. So, and it can just shift that narrative so that they then feel the pressure to support you. So gently offering the suggestion of, I really, I hear you and I know how you feel. And that can be enough for people to be able to know, okay, this person does understand how I'm feeling. It doesn't mean that we have to then take over the conversation with all of our personal experience. Um, so again, this tool is on the e-learning tool on the Resource Hub. I will signpost to it, but it's a really great little 30-minute e-learning just to practice having those compassionate conversations. So yeah, in a world where we all have so much to think about, we've all got life happening outside of work, it can feel very, very difficult to make space to support others whilst our cup is overflowing, which is why we see so much burnout, why we see so much compassion fatigue, and why self-care and self-compassion is so important. So if you've come along to this session, I would imagine it's because either you've been impacted by the topics that we've been discussing, or you support people who maybe have been, or perhaps you're just an incredibly empathetic person who wants to be better informed to support others. But regardless of the reason, we are notoriously bad at practicing self-care and self-compassion. So self-care is self-care is taking an active role in protecting our own well-being and happiness. It's important at all times, but it's particularly important during periods of stress. And self-compassion is one that we talk about less, but it's simply giving ourselves the same kindness that we give to others in our lives. We readily offer support to those around us, if they're struggling in any way. However, we quite quickly neglect our own selves, and particularly when life feels challenging and when we need compassion the most, sometimes our inner critic is our worst enemy. So one of the tools that we will be sending around after this is a self-compassion reflective tool. I would really, really encourage you to take some time to fill that out, as well as a self-care tool as well, just to identify the things that fill your cup so that you can feel protected. And one of the really important things to look at is, what does self-care look like? I think self-care is thrown around quite a lot as a term, which doesn't hold very much weight for people anymore, because people think, oh, I don't have time to go for a run or have a bath. That doesn't actually relax me. But self-care doesn't have to be things like that. And I thought some of these were really nice ways of phrasing what self-care actually is. So self-care is simply the little things you do to look after your mental health. That might be going for a walk, might be going to buy your favorite croissant from your favorite bakery. Self-care is whatever it means to you. Self-care is not a replacement for getting professional help, and it's not about having to fix your problems on your own, but it's a really important part of maintaining good mental health. Even more important when you're working in incredibly high demanding healthcare systems. We all face challenges in life. Self-care is a way of ensuring we're in the best possible headspace to take on those challenges. And make looking after your mental health a priority, discovering what self-care looks like for you, and remembering that when it comes to self-care, it's not one thing, it's your thing. So for me, self-care means having a steady routine, a trusting relationship with my manager and my colleagues. It means me feeling financially secure, and that all feeds into me having good mental health. Making time for making time for myself where I can move my body, where I can walk, where I can exercise really helps me maintain my physical health, which I notice has a huge impact on my mood if I haven't exercised in a few days, or even if I just miss getting outside with the dog before work. Feeling loved and supported by my family and friends and spending quality time with them really helps my emotional well-being, and that helps me fill my resilience cup so that I can keep going. So I think sometimes breaking it down into those mental health, that physical health, that emotional health can be really helpful in terms of phrasing what self-care actually looks like and having some very realistic goals for how you maintain that. I am going to quickly show you a couple of slides on the hub, and then I can take any questions that you might have, and we will share some resources as well. So you've been invited along to today's session because your employer is a compassionate employer. So they are a member of our compassionate employees membership, which means that you have access to a huge resource hub where you can learn more about supporting yourself and supporting your colleagues too. So all staff have access to this hub. You can select from a drop down very easily to be able to signpost you very, very quickly to lots of different areas of support, all around bereavement, caring responsibilities, and terminal illness. So for line managers, you can literally follow step-by-step guidance along the way. For each of those areas, as well as understanding different cultural sensitivities. A lot of us are maybe slightly naive to how different faiths and cultures recognize and celebrate death. And so there's an entire section within there where you can clue up on your knowledge around different faiths and cultures, which can be really helpful if you're in a position and you're managing somebody who's maybe from a faith or culture that you aren't massively familiar with. So loads of really good information within there. As I said, the Compassionate Bereavement Conversations e-learning is also available within there as well as lots of recorded webinars. This one will also be in there. And lots of other resources, both to support yourself and to support your colleagues as well. We're currently developing a coping with professional grief portal within the resource hub as well. So that will be coming in the next couple of months. And that will have some really helpful tools on supporting yourself to recognize the signs of compassion fatigue, of burnout, of professional grief, and some really helpful tools on how you can hold that space for yourself and those around you, but also make sure you have that time for reflection as well. So some key reminders from today to take away. So 5 years on from the COVID-19 pandemic, and many people are going to be facing significant anniversaries, whether that's you working in a healthcare setting and you are just thinking, wow, it's been 5 years and I experienced a lot of trauma during that time, and it's time to give that trauma some space and some reflection. Or whether it's looking at the people around you who maybe experienced a bereavement during that time, who are about to be celebrating a 5-year anniversary. That can feel like a really big deal for a lot of people. So be alert, be compassionate, be present for those around you, and be present for yourself. Be compassionate towards yourself. Give yourself the space to reflect on the impact of the pandemic. And maybe that lasting impact, and anything that you might need to start working on now. Grief is not just something that we experience following a death of somebody that we love, but it's really important to recognize disenfranchised grief and honor the feelings that we have when they arise, especially when we're looking at those different types of loss, the death of a patient, the death of a colleague, that loss of identity, that loss of job, the changes in the role that we thought that we had that maybe looks very, very different from the way that we imagined it being. Really important to be able to sit in the sadness with people, to hold space, and for them to be to create a space for vulnerability that can be much more impactful than actions or words. So often people contact us to say, I'm not sure what to say to somebody. And actually, quite often, you don't need to say anything. You just need to sit with them in that space. And you need to let them know that you're there, and you need to mirror the language they're using. I'm really sorry that your dad died. I want to be here to support you. I will do everything I can to support you. You've got the resource hub. You can be clued up on all the different ways that you can show up for that person on there. And really importantly, lastly, is self-care is not a replacement for getting help. It's not about having to fix your problems on your own, but it's a really important part of maintaining good mental health. So I'm going to leave it there, but I'd like to just offer the opportunity for any questions that you may have, and any reflections perhaps from today, if anything's come up for you, or if anything is helpful from today's session that you'll be taking away. Thanks, Priyanka. Tend to just watch movies. I think that's pretty common for a lot of us. Put on our favorite comfort program and just sit. But yeah, it's really helpful just to have some active things, and some, that can be self-care as well. It's okay to just sit and switch off sometimes especially when the world is quite so intense. So um, perfect. Well, if there is nothing else that I can help with today, and no other questions, please feel free to reach out to us. If you do have any other questions, we'll follow up with the recording and a handout, which you can take and circulate among your teams as well. And any questions that you may have that come up after this, feel free to email us on our Compassionate Employers inbox. Thanks so much, everyone.